And welcome back to Noon Edition, everyone. We are now joined by Tammie Colon, Mental Health Recovery Services Board, and thanks for joining us today. You guys are going to be joining forces in a collaborative effort with some other agencies that you don't normally work with, so tell us about this.
Yeah, so we've built a great partnership with SAFI, which is our behavioral health agency here in our town, Children's Services, and our juvenile justice system. And together, we're trying to coordinate and build services that can really help families stay preserved and provide them the skills that they need in order to use in the future and have less removals of our children out of our homes.
So what brought this on, deciding to kind of join forces, if you will?
You know, in Lima, we have about 600 homes that children are being raised in that they're being raised by grandparents. So we have a generational gap. We have head of households that need skills. And Children's Services is oftentimes getting involved just to be helpful for families. But there's a lot of other things that families need. There's history, there's trauma, there's experiences that bringing the mental health component in, we're hoping to be able to improve the family dynamic and keep kids home.
And obviously the children are the first people that you're thinking about and wanting to make sure that they are well taken care of.
Yeah, and this program particularly goes into the home. So we've really ramped up the services that we offer. It's not traditional office-based, because while we can serve the child, we really need to serve them in their natural environment, and we need to serve the entire family. That means other siblings, head of households, aunts and uncles who are important in that household. And so we're going into the home. We also know that families have things that happen after traditional working hours. And so these teams that we've developed will be available to assist families when the need arises instead of having to wait for an office visit to come a week following.
And a lot of people don't realize how lucky we are here in Allen County that we have local monies going toward these efforts, because in bigger cities and some other states, that's not the case. Yeah,
so we've always been blessed, you know, with our levy. It allows us to really support innovative programming, to really target what we know are high-risk families, individuals, and build partnerships with our local partners. We're not tied down to state or federal funding that directs what we do. So that local money really does allow us to serve our communities as they need.
And those local monies go to the efforts that they need to go to, not necessarily what some bureaucrat in a higher place decides, and you can't really change it.
That's correct.
So
yep.
that's an important key piece to the whole thing.
Yeah. You know, we've done a lot of good work putting our feelers out, trying to be in places where large numbers of people are, the schools, businesses, hospital emergency rooms. But this program is really targeting a very special, high-need families in our community and hope that they can have a healthier life.
And if someone thinks that they might be able to be helped by this, how can they go about contacting you?
Yeah, they actually just need to call SAFI. They are the entrance point. If they happen to be working with another social service agency, they can ask that agency for assistance in getting connected to SAFI, who will evaluate and determine if the family meets the eligibility for the service.
Sounds great. Tammie, thank you so much for coming in today. Always a pleasure.
Yeah, thank you.
All right, stay tuned. Holly is up next. She's got a look at today's medical when we come back.